Our lumbar spine is made up of multiple vertebral bodies and there are some discs in between. So between any two vertebral bodies, there are discs which are soft material which have a covering of a hardened material. So when we do something which leads to the injury of the covering of a disc, the softer material goes out and that leads to the slippage of disc. In simple term, that is called as a slip disc. It is different from other conditions of the back because it is usually an acute phenomena, which means it happens when you are lifting some weight, you're bending over and doing some activity, or you get an injury. It is a sudden act that leads to a slip disc. Whereas most of other back problems, they happen over a period of time. They slowly they degenerate and they become more severe with time. But with slip disc, it usually happens immediately. Common causes of slip disc is when you are lifting weights in a position that is not conducive for your back. So you are bending over and lifting weight, or you are doing some work when you are bending over and suddenly you get a jerk, or when you are having a long drives and you get a jerk, or there is a direct injury or fall on your back which leads to a slippage of disc. These are the four most common reasons. Most common symptom when it all begins, like I said, there is a rupture of a outer covering which leads to the leakage of a softer inner material. So because of that rupture, initially there is a very intense back pain which might last for 3 days to 5 days. Eventually that settles down and that the material that has come out touches the nerve. And when that happens, the pain goes from the back, from back of your buttocks to back of your thigh and goes into your legs. So this typical pain which travels along the nerve into your leg is called as a sciatica, which is a most characteristic symptom of a slip disc. When slip disc is more severe, which means with a larger disc has come out, it can lead to some weakness in your legs, can lead to some numbness, pins and needles, and in extreme stages, it can even lead to the loss of control of your bladder and bowel. Young population between 20 to 40 are at more susceptible to develop a slip disc. People who are in manual labor job, who are doing a lot of lifting, people who are doing deadlifts in gym especially. So sometimes these can lead to an acute trauma to the lower back and that can lead to a slip disc. Apart from that, people who have a long sitting hours, sitting in system for maybe 8 hours, 10 hours a day, long traveling hours, or who have got a family history of similar things in the past. So these all things can lead to slip disc. Slip disc is basically, it's a diagnosis that is made with the help of both clinical examination and some radiological examination. So like I said, the pain typically starts in the back, then that back pain eases off and pain goes into your leg. Most commonly, this pain goes from behind your back, then behind your buttocks, back of your thigh, back of your knee, and can go up to your foot. But again, mostly it is behind your leg. So that is a classical presentation that patient comes. And then when you make the patient lie down and you try to do a straight leg raising, that means you're trying to stretch the nerve. And this can lead to an aggravation of the pain. Again, very classical sign of slip disc. Again, some patients will have some numbness in the foot or motor power, which means some weakness in the foot. That is again when the disc is big. So these are the symptoms which patient will present to you, and some of these symptoms are what clinician will diagnose. And then to confirm our diagnosis, we usually do an MRI scan on the patients. And these MRI scans show us that there is a small part of the disc or a larger disc that has come out and it is pressing onto the nerves. So this is how we make complete clinical and radiological diagnosis in these patients. I think most of people are scared of we might need to do a surgery if there's a slip disc, but that is completely false. So 90 to 93% of the patients, they do not require surgery at all. If they have been diagnosed with a slip disc, what they need to do is they need to do a 5 to 7 days of a rest. And the rest means they don't have to just be on a complete bed rest, but try to avoid doing exertion activities. Lie down, they can walk in the house, take some painkillers, anti-inflammatory drugs, and neuropathic drugs. Once this pain is getting better, then we start them with the physiotherapy, which are spinal extension exercises. Be very mindful that you don't have to do a spinal flexion exercises or any other form of the exercises which can increase the disc. It is the extension exercises that we need. So like I said, 90 to 93, 95% of the patients will get better by just doing this. Rest, some medicines and exercises, which includes physiotherapy as well. There are remaining 3 to 5% of the patients when pain doesn't go away, which means they will need some more intervention. And then what we do is we do a spinal epidural injections or nerve root blocks. So another 3 to 5% of the patients will just require these injections, which are routine outpatient procedures, can be done. We don't have to be admitted to the hospital. It is less than 3 or less than 4% of the patients that actually require anything more than these things. In them also, we wait up to 6 weeks, maybe sometimes up to 2 to 3 months to see how the medications and injections are behaving. Even after 6 weeks to 3 months, if pain persists or weakness progresses, or there is an involvement of bladder and bowel, then we need to do some sort of a surgical intervention where we take out the part of the disc that has come out. When you talk about lifestyle changes, there are few things that if we do constantly, then that can prevent from us having a slip disc, or even if we have a slip disc, that can prevent us from going to a surgical path. So number one is moderation of your weight. So you need to have your weight with a BMI of around 22 to 27, not more than that, not less than that. Number second will be if you have a lot of office job, you're sitting throughout the day, then you need to keep shorter breaks. After every half an hour, take a stroll of 5 minutes and then again come back into your work. Number three is constant exercising, physiotherapy. Make your back muscle strong, which is either by doing some exercises, which can be anything, yoga, Zumba, gym, whatever you want to do. Swimming is excellent form of exercises. Number fourth is stop smoking. So smoking is very bad for your spine and for your disc in particular. It can lead to early degeneration, can lead to early slip disc, and even in the normal gender. Last would be to maintain a healthy lifestyle where you are having a good amount of proteins and less amount of fats, and trying to maintain a non-sedentary lifestyle. Normally, 90 to 93% of the patients will get better without any surgery. All they need is a rest, medications, and some physiotherapy. So within 6 weeks of time, they are back to normal. Some of them may take up to 3 months. So up in 3 months' time, I'm expecting 90 to 93% of the patients going back. For those who don't get better, next 3 to 5% of the patients, they require some injections for next another few weeks, and then they should be fine, good to go. The people who actually require surgery, what we usually do is we do an endoscopic or microscopic discectomy, which is a very small incision surgery. Patients are usually up and about same day after the surgery, and they are able to walk the same day after the surgery. They usually go home next day after the surgery, and they can join work within 2 weeks after the surgery. So rehabilitation is good. They have to take some precautions, which means they cannot bend over, they cannot lift weight, they have to avoid jerky rides, and some more precautions, avoid constipation. Most of the times, the slip disc is absorbed by the body, and the defect that has happened to the covering is repaired by itself in the process of fibrosis. Very rarely. In some people, the body doesn't repair that defect. So once they have had a slip disc, and then after 3 weeks or 6 weeks, they are getting better. But say another after 6 months, they can have another episode when body has not repaired the defects. So these are small subset of the people which have to be mindful of what activities they can do so that the slip disc is not coming again and again. Second thing is, you have to work very properly with your physiotherapist to build up your core muscles of your back and spinal muscles. So these muscles, they take the edge off your bones and your disc so that you don't have a slip disc again in the future. So these are some precautions that you need to take.